Alright, so mammary glands. Now, the thing is that it's more important in terms of female reproduction and childbirth and rearing. But yes, both men and women have mammary glands. And the thing is that in terms of like, it's just the big difference is that the level of development. So these are the mammary glands. Here we see a side cross section, and here we see a frontal section. And what we see is in the male mammary gland, we don't really have, like, the male mammary gland is not that developed. It's behind the nipple, it has ducts, but it doesn't have all these lobules or a lot of this tissue here as well. So that's a big difference between the male and female mammary gland. So maybe the male mammary gland just behind the nipple and maybe about the size of a nickel or so. But yeah, it's not as developed as a female mammary gland. But men do have mammary glands. Now, with the superficial anatomy of it, well, what do we see here at the surface of a typical breast? We see a nipple. Now, the thing is that the nipple is the center part, the raised part here. And often some people tend to say, and this is where the mammary glands have their ducts opening to the external surface. Now, often you will hear people using the term nipple to refer to this entire structure, but this darkened part, and depending on your skin tone, I mean, some people have a darker areola, some people have a lighter areola, different skin tones depending on the melanin. Well, this is the reddish brown skin, so it's usually different colored from the surrounding skin around the areola, but this is what we call the areola, this part that surrounds the nipple. So sometimes people say, oh, so-and-so has big nipples when they actually mean they have big areolas. So again, they're not quite the use, even though lay people sometimes use them interchangeably, they don't refer to the same structure. Now, what you might see in some areolar areas is these little bumps. Now you might be wondering, ooh, are these some sort of disease? Am I not normal if I have these? Well, no, these are totally normal. These are what we call areolar or Montgomery's glands, and what they do is that they secrete a sort of like oily lubricant substance, and especially when a woman is nursing, these come in very handy because they help to lubricate the nipple and prevent it from chafing or chapping too much when the baby is suckling on it. So these are normal, and again, they're not some sort of weird disease. Even if they are a little raised and prominent, they are normal. They are secretory glands. So what they do is secrete this oily secretion to help lubricate the surrounding area. And men have them too. So again, this is what we have. So again, men have nipples, they have areolas, and they have these Montgomery glands as well. Now, again, different types, just like women, men have different types of surface anatomy, and what we have here, definitely nipples on Jason here, and then, but this, again, areola is not the same thing as nipples. And why do men have nipples? Here we have an extreme example of areolar diameter, and this guy, I don't know if maybe he has an areola. But yeah, I mean, just like women, men have different sizes and different colors and different anatomies in terms of their nipples and areola. But why do men have nipples?